much for joining us today. This is our fourth LampLight lunch. We've just started this series to really get to know some of our friends throughout the city who are doing really good work that particularly intersects with our work at the night ministry. My name is Brittany. I also go by Smash. I use she, her pronouns, and I am the Congregational Engagement Manager at the night ministry. And I'm really excited today that we are joined by Dr. Arturo Carrillo. He is from the Collaborative for Community Wellness, and he's going to be talking to us today about their crisis response campaign, which we are really excited about at the night ministry. And it is a campaign to advocate for treatment and not trauma for folks who are experiencing mental health crises. So Dr. Carrillo, can you introduce yourself to us, please?
Sure. Thank you for the invitation. It's a pleasure to be here. I'm happy to start this conversation with you all. This is really, I really want to have a two-way conversation. I really want this to be a space of gathering information as much as it is sharing information. We really respect the work of the Night Ministries. We're super excited that they are endorsing this effort. And we, working alongside with you all, want to envision something different for the city of Chicago when it comes to responding to crisis. And so my presentation will focus on that. By way of introduction, I'm a Southside Mexican boy who still lives on the South Side. I've been, for me, passionate about making sure our communities have a seat at the table, and not just figuratively speaking, but really have a seat at the table. Because, you know, one of the things that, you know, growing up, growing up on the South Side, you know, you see just the impacts of disinvestment and the way that, you know, that plays out in people's lives, and people themselves are just kind of, I think my internet's going, I'm gonna take off video for a second, see if my internet gets better. You know, just to see the impacts of disinvestment, the fact that people, you know, get used to the lack of support and they just have to, you know, deal with situations on their own. And unfortunately that spirals and that becomes much more problematic over time. And so the work of the ministries, of course, captures, unfortunately, the realities of people who are left with no safety net. And for us, we really think that the city has an obligation, and our funding, our tax dollars should be invested in building that infrastructure that is city operated, city owned, and the city is accountable to its residents with, right? So, you know, I'm gonna, again, unpack that quite a bit today. I'm a licensed clinical social worker by training. I've been part of social movement space since 2006 here in Chicago. So for me, it's been just a real blessing to have the opportunity to combine my clinical knowledge with, again, community organizing, community-based building work that I've, you know, really care deeply about and really respect all of those of you who are engaged in that type of work, right? And so, you know, how do we then build this movement and this effort to be part of the policy making process is the end goal here. This is, again, like I mentioned, having people speak on behalf of their needs to people in power, and not having the demands be set for them, but really being built and rooted in community. So, you know, again, this has been, you know, 6 years of work, 6 years of organizing, 6 years of research, 6 years of partnerships with different organizations, different stakeholders. And as it goes with coalition building, right, you know, it's a little messy at times, but we want to stay focused on the end goal, again, which is making sure we have a safety net in the city of Chicago after so much disinvestment. So I have quite a lot of information to share. Again, I don't want to like bog us down with just the data. So I'm happy to share the data and be able to provide a full presentation on this, on our efforts up until now. But given that we have an hour, I want to maybe just do a quicker, you know, 20-minute presentation and then use that as a springboard for a bigger conversation.
Sure. I think that would be great. Yeah. Give us a presentation and then we'll follow up with any questions that we have. That sounds great.
Okay, excellent. So before I share my screen and drop in the presentation, I just want to get some initial impressions. I want to kind of take a temperature check of the room. How familiar have people been with this campaign? How engaged have you been? If you know anything about it, you know, what is it that you'd like to see as we move forward with this effort, you know, and just to kind of get a sense of where people are at. And just feel free to chime in either through text or just unmute yourself.
Hey everyone, this is Jenny. I've heard this phrase before, but I really don't know much about it. I just started hearing it pop up in conversations and meetings and emails and such.
Okay, great, thank you.
Thank you.
Anyone else? Kevin's not terribly familiar, but okay, great. We'll definitely happy to share as much as I can today. Okay, thank you, Rachel, for joining. Okay, Teresa. Has anybody been engaged? Oh, wow. Is that Canadian friend here in the States or out in Canada? Oh, okay. Yeah, it's a whole different context. You know, I mean, as you all are well aware, you know, we are in bad shape here in the US, so. Great. But yeah, Toronto has been one of the cities that we've seen has also been really rolling out this initiative there. You know, it's a twofold problem, right? One is, of course, understanding that crises happen because of the lack of resources. So engaging people proactively is super important. But unfortunately, also, once you engage with people in crises, then where do you send them and how do you provide the follow-up care necessary? You know, the mayor's position in the city has been that the city should play the active role of convener and delegator, right? So kind of very this neoliberal model that, you know, the state should not be operating provision of care; they should be contracting out, and we see some fatal flaws in that. So we do want to kind of ground ourselves in what the conversation today will be about. What would be the role of the public sector in building this out, right? Nonprofits are spectacular. The Light Ministry is among them, right? There's some stellar work that's happening within the nonprofit sector. But it's, as it seems, the city is really intent to put all the social responsibility of social needs on, again, the nonprofit private sector. The latest example, of course, as we see during this pandemic, is contact tracing, right? Contact tracing used to be, in many ways, still is the responsibility of the Department of Public Health, but the Department of Public Health does not have the staffing because of just, you know, reduction after reduction over so many years. And the lack of investment in public health infrastructure has led to the lack of staff necessary to do the contact tracing. So what does the city do? It throws it onto nonprofits. It contracts out by way of RFPs to nonprofits to do contact tracing. And as a result, we have a failure of a contact tracing program in the city of Chicago. Because again, nonprofits have a lot of responsibilities aside from contact tracing. But this is, again, a clear example of where and how kind of this lack of investment has really had a tangible impact on our current crisis. You know, another example, of course, is and this is kind of, again, a neoliberal policy, has been the overinvestment or the intentional investment of a sizable portion of our funding. You know, 36% of our revenue, of our discretionary spending, goes towards policing, right? So police are the front line of social response to crises as we have it now. So we're going to talk about what that looks like. You know, there's been recent, even recent information that has been shared, where, you know, the amount of CARES Act spending that has gone to policing also made up a sizable portion of what the mayor decided to spend on. So about 65% of that money that was for personnel went to policing instead of, again, staffing, you know, staff and within the Department of Public Health to tend to the needs of people in this pandemic, right? Only $18 million went to the Department of Public Health from that total amount of $403 million. And by comparison, $280 million went to police, right? So, you know, we're talking about an enormous amount of money that is going to ensuring policing happens. And what does that really translate to for communities who are in the highest need? And we'll talk about that as well. Finally, you know, just again, why this is so relevant for the conversation today is that we have $68 million that are still available, right? There's money that was not spent from CARES Act funding in 2020. And this is where, you know, treatment of trauma comes in. We really have been intentionally and clear from the start that our proposal for crisis intervention in the city of Chicago is about having social workers respond to crises instead of police. Smash, you're absolutely on point. This is exactly what the campaign is about. And absolutely, many cities are already doing this. The initial position of the mayor, and this is just, again, this is full public record. She made this comment during her budget address in 2020, was that her position is that crises in Chicago, for some reason, are entirely different, right? So the point is that, models that have played out in Eugene, Oregon for decades, for some reason are not applicable to the city of Chicago. It's a bit of a dog whistle position, that, if you ask me, because it really is kind of making a comparison and saying, for some reason, people in Eugene, Oregon, mostly white communities, can have non-police response, but Chicago, too savage, too wild. So for some reason, it's just not going to work here. And that is offensive in many ways. It's also deeply troubling that our mayor has that position. So for us, we knew that this was going to be an uphill challenge in order to put forward this council order, which we did in September. And this council order was very intentional to, again, delineate how we wanted the city council to be able to design and ask for accountability within the public sector in order to ensure that the design of a crisis response system would be intentionally non-police by its design and by its implementation. I'm sharing my screen now to share a little bit more about the details. So let me get this going. Okay, can everybody see that? Okay, excellent, great. So going back to so this is a map of the city of Chicago that really breaks down where and how access to mental health services looks like currently. This is the current system as we have it, right? This is very much a system that has been designed in a certain way to give access to people in certain communities, full access to mental health services, and other communities which do not. Even though the map says less than one therapist per 1,000 community residents in the community areas that are yellow, what really the number is closer to 0.2 therapists per 1,000 community residents in each one of those communities that you see highlighted in yellow. The green and the dark green, the shades of green, of course, represent communities that have ratios of therapists over one therapist, in some cases 4 or 5, upwards of 100 therapists per 1,000 community residents in certain neighborhoods. And as you can see, this is not an even distribution of access to mental health services. Now, again, this is the system we have because, again, we are in America where we have a managed care model of mental health service delivery. Therefore, people who have access to means and health insurance have an abundance of choices, whereas people who don't have that disposable income or health insurance really are given very little choices. And so the city will clearly make their position that actually those neighborhoods you see in yellow have more than enough mental health services. What are you talking about? Each one of those communities has nonprofits and FQHCs that offer mental health services. And what we're doing, and this is the mayor's official position, is we're going to fund them to do more, right? So what we're saying is that, again, the city is taking the active role as philanthropist to ensure that FQHCs, which already are underfunded for providing behavioral health services, may receive additional funding to maybe, and this is a big maybe, add a clinical capacity to see more people within their clinic. So that gives people all of but one choice to see therapy and receive therapist support at an FQHC. Whereas, again, as we see on the Gold Coast, the North Side, the near North, you have people who have a variety of options of therapists, well-trained therapists who have LCSWs, LCPCs, and many other degrees to provide trauma level care for people who are dealing with a variety of mental health needs, right? I could keep talking about the data. I mean, if you start looking at where behavioral health hospitalizations are, you see it, of course, correlated with low-income communities of color, higher rates of behavioral health hospitalizations, higher rates of incarceration, higher rates of 911 calls for behavioral health needs. Like it's completely directly connected with poverty and being a person of color in Chicago, right? So how do we address this? And this is where we've been really, really intentional in designing this treatment on trauma counselor that I mentioned to have the following points. Now, we really wanted this to be a pilot that was well designed with community input from the start. I'll pause on what has happened and what is the current plan and how it's been developed in a minute. But I just want to highlight the elements of the crisis of the Trinidad Trauma Council order that was introduced in September. It was introduced actually coincidentally, I guess, on the very same day that the mayor introduced her violence prevention plan, which included her designed co-responder model for crisis response in Chicago. So it was a clear distinction from the start. We were asking for $5 million set aside. Again, we were told $5 million is way too much money. Yesterday we find out that that there's still $68 million sitting on the table of CARES Act funding that could have been designated for this initiative. We envisioned a system that would create an option where people could call 211 instead of 911 when dealing with a crisis. The idea, of course, being we want to give people choices. We all know that when you call 911, it's because it's life or death, right? It really is a serious crisis. And if you think about that threshold, right? If you think about that, that's the moment when people can finally call to get support for mental health crises. It's no wonder, unfortunately, that people who have called 911 in that ultimate moment of crisis have had horrible experiences with, of course, police response, because again, surprise, surprise, the presence of police during a mental health crisis will automatically escalate any crisis. I mean, if a cop pulls up behind me and turns on his lights and I'm driving down the street, I feel escalated at that moment, and I'm not dealing with a mental health crisis, right? Like, just having the possibility of being ticketed, gives us a panic attack sometimes, right? So where and how do we expect police to be responding to crisis when they're at that heightened level of crises? So the idea being that we could give people an option to call 911 or 211 prior to things leading to that level, and again, preventing that sort of crisis that we're left to deal with when people call 911. We wanted this to be an open planning process. We want an advisory council to be inclusive of community residents and community input and community organizations. That has not been the MO of this mayor or the previous one. I'll talk more about that in a minute. We wanted to pilot this out of 2 of the CDPH mental health clinics. There's currently 5, as you saw in the previous map. I'll just jump back to it. The areas, the dots in blue are the locations of the 5 mental health clinics that are currently in operation. The X's in red are, of course, the 7 that were closed, 6 that were closed, and the triangle on the bottom is 1 that was outsourced, and again, closed for all intents and purposes to a private provider. And going back on this map, Chicago once had 19 public mental health clinics. I just want to put that into the conversation as well. Could you imagine if there was 19 dots up in the city of on this map of the city of Chicago, with each one of those public mental health clinics having its own community advisory board? This is the way the public mental health system was operating, in the late 80s, early 90s. So there is a historical context for which this investment has occurred. As I mentioned, I'm a South Chicago resident, so in the 10th ward on the southeast side, there was a public mental health clinic, and to not have it here, again, you see how that plays out in people's lives. Our pilot would have envisioned having 2 of the 5 public mental health clinics serve as the home base for crisis response teams. Each team would have a combination of a clinician and a paramedic and a peer support worker. So the idea being that we would have 14 clinicians, 16 paramedics, 7 peer support workers. The clinicians and peer support workers would be part of CDPH staff, right? So they'd be public employees, right? With all the salary and benefits that would come to a public employee for this type of frontline work. This is what the mayor proposed. In her plan, there was $1 million set aside for a co-responder pilot program, which is, again, to be absolutely clear, is a police officer riding with a social worker in the same vehicle to respond to the same crisis. The commitment was to have CIT officers be the ones who are part of the pilot. The system would have been will be operated out of the 911 call center. This is a program that was developed behind closed doors. In the city of Chicago, the mayor's office, both current mayor and the former mayor, created a task force of mental health providers to define policy around mental health services and social service delivery in the city of Chicago. Now, of course, on the surface, it makes sense, right, to have executive directors and CEOs from major nonprofits around mental health services to be defining the policy. But in reality, what we're seeing is that this has been a closed door planning process that as an outcome has developed a co-responder model as its response to crisis response, as its proposal for crisis response in the city of Chicago. Our position is that that's pretty tone deaf, given that, if community involvement would have been encouraged and part of the design, we would have been absolutely clear that non-police response is what the city really needs. And again, is something that people throughout the city and throughout the nation have been calling for in the summer and many years leading up to this past summer. So thinking about how a closed door planning process shapes the co-responder model, which is being developed with the design and the intentional implementation by the police department. Commander Ursetti has been the CIT officer, sergeant, commander that has been leading the design of this project. And this plan does not commit to any funding or additional funding or resources or coordination of provision of care through the public mental health clinics that exist, right? So we again are seeing this lack of investment. How does this look? How does this compare to other cities? So I really want to kind of put us also in the context of the national trend towards creating crisis response that does not involve police. On the map, on the slide here, you have Portland, Albuquerque, and San Francisco, all of which have been in the active planning process and implementation for a non-police crisis response that is operated exclusively out of the public sector. Actually, Albuquerque is designing an entire department for community safety to run and operate their crisis response system that is a mayoral level department that, again, is a standalone department to design and implement this crisis response. Also, Albuquerque is under consent decree as well, right? So it's not, I mean, don't be fooled. The fact that a co-responder model is being proposed and tied to the consent decree is not the reason we should have a co-responder as its only option. Another city like Albuquerque, who is also under consent decree, has designed a complete entire alternative that does not involve policing. Again, as I mentioned, the Chicago Council for Mental Health Equity has been the space in which this design has been developed without public input or participation since its inception, and was only recently open to the public after a complaint was filed with the Illinois Attorney General's in violations of Open Meeting Act legislation. So at least now the doors are open, but public participation is not a part of the design. So by comparison, you see San Francisco, which has created a public task force that involves public input with public invested organizations and community residents to design what the crisis response system will look like, and they've set aside $16.8 million for their pilot for these next 2 years. Both Albuquerque and Portland are operating theirs out of the out of the fire department. Albuquerque, as I mentioned, has its own department being developed for this. Again, in Chicago, and I've had conversations. Our coalition has been in conversations with these cities and their people responsible for rolling out this pilot. As I mentioned earlier in the conversation, the thing that they all highlight and they'll say to us is, well, we identify these crises, but sometimes we don't know where to refer them to. And then we take the opportunity to share how Chicago has 5 public mental health clinics, and they just are in awe, and they would love to have public mental health clinics in their system to tend to the needs of those who are falling through the cracks, right? This is why we have safety net systems in place, right? And so for us, it just confirms the importance of creating this within the public sector. So this has been the effort, right? And this has been where the campaign has gone since 2018, when we released research, all of the research you can find on the website. And the research has been designed to use data that is collected by community residents, involving community residents in its design. For those researchers out there in the room, CBPR design, community participatory research, to then be able to define and develop policy recommendations based on what data was gathered. In our 2018 study that was released, we spoke to nearly 3,000 community residents on the southwest side of Chicago to get their understanding of what mental health needs and access barriers are for them. And surprise, surprise, stigma was not one of the highest, was a very minimum factor to access to care. What we found, of course, was cost and lack of health insurance, along with no therapists in those neighborhoods being the biggest barriers to access to care, not stigma, right? So also we found that 80% of the people who responded to that survey wanted counseling services. They were actively interested in receiving counseling services. So again, there's much we could talk about in that area, but the question then becomes why public, right? In our society, we all, and as a social worker, at least in my training, I never really was given many options, right? As a social worker, you're either going to set up your private practice or you're going to work in a nonprofit sector. And you think about that, right? Why is that map the way it is? Well, because you can make a better middle class job for yourself if you set up your own private practice, on the north side, than live out a career in the nonprofit sector. So why the public sector? Why would that matter? Well, one is sustainability. We know that when something is publicly funded, publicly invested, and part of the public infrastructure, it becomes part of our system, right? It becomes almost, again, like the Chicago Public Library system, the public park system in Chicago, right? These are tax-funded systems that we all benefit from, that are part of our infrastructure. We just take it for granted that there's a library in our community. That was a political choice that happened after the Chicago fire, to finally create a public use, open library system. Prior to the Chicago fire, all the libraries were fee for service model, right? So you bought your membership to join a library. Now we take for granted that this is a resource that's available to everybody. So sustainability, right? It will outlast any administration. Quality. We know that when you have good pay, good benefits, and maybe, I don't know, even a pension, right, for your workers, you will retain them. You can train them. You can support their growth, right? You will not have the high levels of turnover that's common in the nonprofit sector, right? So we want to ensure that there's sustainability, quality, and also accountability and transparency. Nonprofits, as great as they are not accountable to the general public. Nonprofits at best are accountable to their board of directors and their funders, but not to the general public. And when it comes to public safety, and this is again the issue that we're talking about today, responding to crisis in community, there's a lot of accountability and oversight that needs to be built in order to ensure that people who have a crisis in the city can have their needs tended to with the highest quality of care, and making sure that, again, there is accountability and follow through to ensure that people can receive the support that they need. CDPH and CDPH public mental health clinics that we have can be the site for that. Currently, the public mental health clinics have a public oversight board. Those meetings are open to the public. If you're interested in seeing what that looks like, the next meeting will be is scheduled for Monday from 6 to 8 p.m. And you're going to see a meeting in which consumers, advocates, community residents are part of the conversation with administrators from CDPH to talk about the public mental health clinics and the services that they provide. This is part of the structure. Actually, as I mentioned earlier, all 19 public mental health clinics in the city of Chicago at one point in time, when they existed, each one of those had a public mental, a community advisory council. And again, we call for that in our proposal. We want the 5 public mental health clinics to have a locally sourced advisories and support council that can maintain oversight and accountability, as well as provide support for its local mental health clinic. Again, we have been very active. We are presenting to you today because we want to see mental health professionals, we want to see community residents, we want to see social service providers be part of designing this system, to be part in committing to the creation of this system. Recently, we had an op-ed that was circulated during the budget negotiations. And in a matter of a weekend, we had over 200 mental health professionals sign on the petition in support of that op-ed, and stating these points to everybody that was willing to listen, that, we are saying the same thing. We do see mental health care as a human right. It should not be a privilege or a luxury afforded to only a few. And so this was the petition that was signed. These are some of the quotes from social workers, therapists, faculty at universities who really sought to lend their voice to this campaign, and we had a great response in a short time. So this is a petition that's still open. So if you're interested in signing and putting in your own thoughts, by all means, that there is the bit.ly. I'll drop it into the chat after this presentation. And finally, this is where we've been again asking for community and public input. We have a few ways you could do that. We have a survey that we've been circulating. Please help us meet our goal. We want to make sure that we at least talk to 500 community residents citywide. Anyone who's interested in filling out the survey can go onto these two links, one in English, one in Spanish, to be able to fill out their survey and share their thoughts on what their mental health needs are and what their view is of the public mental health system in the city of Chicago. If you fill out that survey in the next week, we can incorporate this into our final analysis that we will be sharing with our elected officials as well. We have a sign-on letter. Thank you to the Night Ministries as a signatory of this campaign. Any organization that's interested can sign on. You will be listed as a sponsor of our efforts. We have currently over 60 organizations, a very diverse list of organizations, including major organizations like the NASW Illinois chapter, CIT International, which supports CIT training, but also smaller organizations, community-based organizations like BLM Chicago, many nonprofits, many service providers. So again, if you are interested, feel free to take a look at the letter and sign on. Again, this is in support of the Treatment and Trauma Counselor that I mentioned earlier. And again, you can find any additional information on our website, and feel free to follow up with me directly if there's anything else I could do to share and provide context for your work or for your support in this campaign. So, okay, I've said a lot, and okay, I think we have at least a solid 20 minutes to have a conversation. So any immediate response, reactions, questions, thoughts?
Thank you so much, Dr. Carrillo. This was really helpful. I want to point out a question by Rachel in the chat that I think is a really helpful question. Rachel said, how has the increased access and acceptance of telehealth for therapy services impacted these numbers? And I asked this because that has been really helpful for us at the Night Ministry. I'm starting to provide more services for our clients on the street through telehealth partnerships that we have with some providers. Can you talk a little bit about that?
Yeah, I think it's a great question. I mean, it's a bit of a mixed bag, right? You know, we know that people by having access to and I guess I'll respond to that question thinking about how the public mental health clinics have gone to this telehealth model. One is it allows for easier access to, right? You don't have to physically go to speak to a therapist. So we have absolutely been promoting the phone number and a central line for the CDPH mental health clinics. It's really unfortunate, however, because these clinics that remain have been disinvested to the point that they didn't even have an electronic medical record system, right? Like we advocated and we fought in 2019 for additional investments. And that was one of the concessions we got from the Lightfoot administration, was that they finally authorized $2 million to, while they were giving $8 million to the nonprofit sector, which was the plan. That was the plan. There was nothing else to it. It was like, we're going to fund all these nonprofits and FQHCs to take care of the problem. Because of our aldermen and city council and the pushback we did, one of the concessions was that they would, in addition to that, give $2 million to public mental health clinics, so they could finally get an electronic medical record system, so they could finally hire APN nurses, so they could finally have community outreach workers, staffing to be part of the, you know, so there was a lot of there was a small victory there. But my understanding again is that the need for accessing telehealth was part of the design already. They were trying to coordinate the creation of psychiatric telehealth within the CDPH clinics. And yes, absolutely, it provides a more opportunity for exposure. People who don't necessarily live in that community where the clinic is can now call a number and be connected to services. So we promoted that. But it's not the solution either, right? Because we know, of course, that therapy is something you want to do in person sometimes, right? People who live in overcrowded housing do not have the luxury to have a quiet, private space to have a very deeply personal conversation with somebody, right? So we really see that giving people options, of course, is what we advocate for, and that's one way of doing that, but not the only way. Thank you. That Chicago's Not Broke book is, yes, it's a great Great resource, absolutely. Lies and tangled webs are definitely part of this debate. That's for sure. Sorry, as I'm reading through the comments, feel free to chime in if anyone wants to unmute their mic.
I'll point out this this question by Kevin is, how have the pilot programs been going in other cities, and have they seen positive results? I know I've heard this question from other folks as well.
Great question. I will share the report in the chat that was just released from Denver, hot off the press. 6 months of data was gathered on their crisis response. So Denver has an interesting model. They have both a co-responder model and a separate non-police response model called the STAR program. And a STAR program is operated by a nonprofit in Denver out of like 2 select communities, my understanding. But the report itself is very interesting because it captures and shares the data for 6 months of pilot. And turns out in 6 months of the pilot, no one was arrested. Turns out when police do not get involved, there was also not a need for crisis response teams to call for police backup, right? When people are in crisis and needing social and emotional support and material support, and somebody could show up to provide that, there's no need to arrest them, right? So so that's definitely been a very and again, these are new all the cities that we're talking about are fairly new in developing their crisis response programs. The only one that has really been kind of at the core of trial and error for the last 30 years is the CAHOOTS model in Eugene, Oregon. So that's why everybody references the Eugene model. And again, for us, it has been also part of our outreach to learn and understand how they've done it there. And again, the data there is striking. I think their program is only like $2 million of operation cost, and the amount of money they save hospitals and the police department more than makes up for the cost. So I'm happy to share those links as well.
Thank you. I'm going to ask one more question and then I'll let other folks hop in. Another thing I've heard and I hear every time we have a conversation like this, no matter the topic, is what can we do? How can we as individuals or organizations, other than, we're signing on or supporting the campaign, what can we do individually to assist this process?
Well, I think it's important for you to talk to your neighbors. I think it's important for you to bring this conversation to your networks. We have a Twitter hashtag because we saw that there was a need for us to, engage in that space of dialogue. Again, people in power will shape a narrative that benefits their interests, and they will push that. They will push that narrative until it becomes truth in their opinion, right? And unfortunately, an issue as complex as this cannot be. It requires community input. It requires people who are on the front lines, like the Night Ministries, to say, yes, we see these needs. We can do our part to support people in need. We are not the answer, right? And there's no one answer, but only in America do we think about the amount of tax dollars that we have and we spend going to only policing as a sole answer for public response to crises, to social needs. And then the absurdity that even when CARES Act funding comes to support people in the pandemic, we then double down on policing as the answer. It's just, it blows your mind. But it is unfortunate, and that happens because, again, people in power will shape the narrative that will benefit their interests. So where and how can we build a base in our communities with our networks to support these efforts? That's important, right? Aldermen are not expecting people to call them about this issue. They're not expecting them to receive phone calls on people on behalf of why the public sector and public mental health clinic system matters in Chicago, right? It's been pretty clear up until now that they feel that the nonprofit sector has taken care of the problems, or again, they just need a little bit more cash to get it done. And I think that's a very inefficient model. I think, unfortunately, even if you are funding 30 organizations to offer mental health services, that's 30 organizations that have 30 overhead, right? That have 30 management, 30 different directors, 30 different, right? Like everything gets multiplied out when you subcontract it. And it doesn't necessarily, it may save the city money, maybe, I don't think it does, but it may save, but it doesn't allow us as community residents to then hold those organizations accountable, because they're nonprofits, they're FQHCs, they're doing their own mission work. But if it's in the public sector, right, this is where we can then have a voice. And so again, how can we get people in our networks to think about this issue in this way is why we've done these presentations for groups like yours, and we're happy to share this information and support it any way we can.
Does anyone else have any questions?
And please, I if there is any questions or doubts you may have about this, please air those as well. It helps us, of course, a lot to hear people's concerns or doubts. One of the questions that I've received in other presentations has been, well, how are we going to support the social workers who are responding to crises, right? Responding to crises is not an easy thing to do. And I'm happy to be a social worker who can say this, right? Because, as a social worker, I am living on the front lines, doing the work to respond to people's needs, and responding to crises is one of those things that you have to be well trained to do, which is why you have to get a master's to do social work, to do psychology, community counseling, right? Like there is a lot of training that goes into it. And so, aside from the degree, let's just say aside from the degree, we know that the CAHOOTS model trains their crisis workers for 500 hours. Their training is 500 hours. That's about, 3 months of training? By comparison, CIT trained officers, which the city touts as the answer to crisis response, only receive 40 hours of training once in their career to be categorized as a CIT trained officer. There's not even, it's just 40 hours and then you're a CIT trained officer at most, right? Because there's a shorter version of the CIT training that officers can also receive. Right, so we're talking about, and then, so you support your social workers and your crisis response workers by giving them the training and the care and the support that they need to do their work. Police officers, by comparison, only have, I believe they have to have an associate's degree, and have a starting salary of upwards of $75,000, benefits, pension, the whole thing, right? Like that's, good for them, right? But social workers, crisis response workers who are part of the system should receive the same as well. And we can afford to pay that if you're not outsourcing for it and covering overhead for many organizations. You can just invest in your staff and to provide them the support that they need, both material and the pay support that would make sure that they're doing their jobs well, right? So this is the way we would call for that. Can there be access to the slides? Absolutely. Yeah, I'm happy to share those with Smash, and Smash could get them out. If I don't get them to you, Smash, please pester me. I will get them back. I will get them to you and then share them out.
Will do.
For people who are interested in supporting this campaign, by all means, go on our website, put your name in. We could add you to our listserv. We meet once a month. Right now, we have actually we have our meeting later today at 1:30. So we are going to we convene our membership group once a month, which, like I said, includes community residents, people from all walks of life, as well as people who are part of mental health providers, social service organizations, nonprofits, and so we convene once a month. And then we have working groups. So if people want to be more engaged, there's different working groups you can include yourself into. But it all starts with reaching out on the website and just sharing your information.
Awesome. Thank you so much. I see one more question there if you want to answer that about crisis
I
calls.
don't want to guess. I wish I could. I mean, NAMI right now is a crisis line. They were contracted by Mayor Emanuel to be the crisis response system for the city, crisis response hotline for the city. They don't have 24-hour coverage, but they do have extended hour. And again, I don't know if their data is publicly available. NAMI operates the hotline, so I'm not sure if they have that, but that would probably be a good indicator of what would be expected. Of course, as everything, it depends on, you know, how many crises people feel comfortable reporting or calling for help for, right? But yeah, unfortunately, you know, we've seen many examples where crisis calls end up going really bad when police respond. It's not safe for anyone, and unfortunately, you know, there was a Tribune reporter who did an amazing in-depth investigation of a crisis situation that occurred actually here in South Chicago, where a trans woman had a mental health crisis. And again, in that heightened moment of crisis, the mom in the middle of the night had nowhere to turn to but called 911. There was 2 police officers who responded. I believe one was CIT trained. Officers did draw their weapon when they saw her with a knife. She was self-cutting. And then in the tussle, when the police officers got cut and the woman was tased. And so now she's in the men's correctional facility of Cook County Jail receiving mental health services. So this is the system we have today. So I'll share the link to that story too, if you're interested.
Yes, thank you. I'm gonna ask you one more question from the chat, and then we will let you go because you do have a meeting coming up. Anna asked, what kind of metrics would we look at to know when and if this type of change is working?
Oh, that's a good question. We want that to be part of the design. We want people to design those metrics, or we want people to, you know, it's interesting because, like, again, when you give yourself the freedom to think about what crisis looks like and what crisis response could look like, you know, I'll give you an example that I heard and just my jaw dropped, right? It was Albuquerque. For example, in Albuquerque, part of the crisis, so it starts with what types of calls are considered crises, right? Obviously, most people are starting with non-police crisis response, right? So that means that you're probably gonna weed out the violent calls, right? If there's an arm, if there's a gun, if there's, you know, threats for suicide or homicide, there are, you know, those type of calls will not be going to the crisis response team. That's not, you know, not police involved. But then you also think about the calls, for example, that could be included. And I'll give you an example. In Albuquerque, they were including shoplifting, low-level shoplifting as a crisis response call, not a 911 police call. Right. And if you think about it, it makes a lot of sense, right? If somebody's at the local convenience store stealing food or stealing, right, you know, whatever deodorant, right? Like there are some needs here. Baby formula, right? Like, you go to Walgreens in my neighborhood and all the baby formula is locked up behind keys, right? And it's like, there's an indicator there. That's an indicator that if maybe, you know, we would provide people with the supports that they need, they don't have to steal baby formula. Right. You know, and so there is something that to be said about how you can envision crisis response in an entirely different way if you're not automatically knee-jerk reaction thinking about police involvement. Actually, that was the order the mayor gave in San Francisco as they were designing. We were told their crisis response team, that the mayor told the city officials and those representatives who were part of the advisory council to envision what crisis response would look like if there were no police. Right, think about leadership, right? Think about the vision, right? And by comparison, think about what we have here in Chicago when we have CARES Act funding policing. Like it's just, it's just reprehensible. That's right, Rachel. Yeah. So yeah, this is kind of the campaign. This is the work. It's been, again, the effort of many people. I am just here to share and represent what we've been doing, but not necessarily. You know, this is a bigger effort, which is something that we've all been a part of. So I'm going to share the article in the chat that I was referencing. I will also share the report from the STARS program, and I'm happy to take any last minute questions.
Yeah, thank you. Everyone is I've seen lots of comments about thanks so much for all this information. I know a lot of folks came in without a lot of information, and I'm sure we've all learned a lot. I know at an individual level, and I can say we at the Night Ministry, we're just really excited about this and want to be involved however we can, because we know that not only will this crisis response campaign be super beneficial to our clients, but just to our communities in general. So I thank you so much, Dr. Carrillo, for your time, for the work you're doing, and look forward to continuing this work with you.
Thank you all. Thank you all. And yeah, feel free to reach out if you have any questions. I'll put my email in the chat as well. And I will, let me also share, please fill out the survey, share the survey within your networks. That would be a big boost for us. That data is going to be really important information that we want to share with our electeds. So I'm going to drop that into the chat as well. And if anybody wants more information on any of this, I'm happy to provide it. Feel free to email me. Here's a chat, and I'm also going to drop in the image that you had in the presentation. Again, that would go a long way if you could share it within social media networks and your Facebook pages and all that. So thanks once again for all your support.
Yeah, thank you so much for joining us, and thanks everyone for joining. I'm sure we all have lots of work to do in this arena, and please join us next month. Next month we'll be talking a bit about housing and developer money and displacement. So always something to learn more about and take action on. So thank you everyone, and enjoy your weekend.
Thank you.